Okay, so we take the keynote stage by Dr. Gbonjubola. Dr. Gbonjubola is a psychiatrist, and he will be talking about his maternal mental health as a public health priority. I love this breaking the silence. What we should have been doing a very, very long time ago. So I will invite Dr. Gbonjubola. Dr. Gbonjubola, where you served man. Yeah. Can I have a word? Oh, she all right, Dr. Gbonjubola, it's a pleasure to have you. Come on, let's celebrate Dr. Gbonjubola. Dr. Gbonjubola, he is distinguished and the keynote will blend network of emotion to catalyzing commitment, and it is designed to act on the deeper discussions in reality of the Nigerian concept, to ignite a sense of shared responsibility and inspire attendees to build beyond awareness to advocacy and systematic change. Ladies and gentlemen, Dr. Gbonjubola.
All right. A very good morning to you all, distinguished ladies and gentlemen. Please, can you confirm that you can hear me?
Loud and clear.
Right. So I feel like upsetting things a little as well. I feel like the convener should have spoken before me. And I did send a message to say that, convener, please speak. It's the order of things. But because I know that I have been put on the podium to speak right away, I would jump right into my keynote for today's conversation. Right. Very good morning to you all, distinguished ladies and gentlemen. Please, can you confirm that you can hear us? Loud and clear. Right. So I feel like upsetting things with this one. I feel like okay. Right. So I'll go right ahead, even though I can hear a bit of an echo. Right. I'd like to start today's conversation with the story of Grace. Although not her real name, Grace had just given birth to a beautiful set of twins in the ancient city of Ibadan. Her family was overjoyed. Their years of infertility had now been replaced and heralded with double joy in form of twins. Everyone was happy, but not Grace. In the days that followed, she stopped smiling. She stopped sleeping. Then she stopped speaking altogether. Her husband dismissed it as the baby blues. And mother and mother-in-law invalidated her feelings, saying that she was too lazy and should be grateful that she had twins. The church said it was a spiritual attack. I mean, who wouldn't be happy when their trouble was rewarded by double? On the morning of the naming ceremony, Grace went missing. But she was not alone. She took the twins with her. She went to a popular bridge in Ibadan and threw the twins over, one at a time, into the river below. As she was about to jump, she was rescued by onlookers who had heard the cries of the babies as they fell to their death. By the time Grace was brought to the hospital, it was discovered that she had attempted to take her own life at least 4 times following the birth of the babies. She survived, but she will never be the same. This is how we lose women. Not to bleeding, not to infection, but to untreated despair. Distinguished ladies and gentlemen, I am absolutely honored to be here today to speak on a subject that I am extremely passionate about. A topic that is urgent, impactful, and universal. Breaking the silence, maternal mental health as a public health priority in Nigeria. I'd like to thank the organizers for the opportunity. And of course, thank you for lending your voice to a topic that is pivotal, yet one that we rarely talk about so much. It should never hurt to be a mother, but it does, sometimes and many times. From conception to pregnancy-related challenges, physiological and pathological changes, from morning sickness to hyperemesis gravidarum, to mood and emotional changes, to the reproductive trauma that comes with infertility, with pregnancy losses, through childbirth, and even the postpartum period. Many women struggle, many women suffer, many women are shamed and are repeatedly silenced as society expects, even without prior experience, that women understand and figure out all the roller coaster of changes and emotions that come with being a mother. In Nigeria today, maternal challenges are not just the beginning, they are a battleground for the life of the child and that of the mother. Maternal challenges may also reflect the end of not just the mother, but that of the child as well. Behind what is known as the miracle of motherhood, beyond the women who risk their lives to bring new life into the world, there are wounds that we cannot see. In Nigeria, there is a deeper, quieter crisis, one that we rarely speak of, but that we're speaking on today: maternal mental health. Maternal mental health is the pain behind the painted faces and smiles that we see. And too often, it ends in tragedy. Today, I want us to break the silence, not just for Grace, but for the thousands of women like her across Nigeria and, of course, across the world. Maternal mental health encompasses the physiological well-being and psychological well-being of women during pregnancy and up to 18 to 24 months postpartum. It is indeed a crucial aspect of overall health, as perinatal mental health conditions like postpartum depression, anxiety, psychosis, substance abuse disorders, and even suicide emerge or worsen around this time, and of course can significantly impact both the mother and the child. The conversation on maternal mental health often focuses on physical survival, and for good reason. Did you know that Nigeria is one of the most dangerous places in the world to give birth? There's an estimated annual 40,000 pregnancy-related deaths, which account for about 14% of global maternal mortality. That places Nigeria as one of the top 10 most dangerous countries in the world for a woman to give birth. But beyond pregnancy and childbirth are women who survive physically but suffer psychologically. In Nigeria, 20% of women suffer from perinatal mental health conditions, and 1 in 4 will experience postpartum depression. Many more will face anxiety, trauma, postpartum psychosis, substance use disorder, and even suicides. Unfortunately, many of these women lie undetected, many will never be diagnosed, and most will never be treated. Maternal health focuses on the physical, but emotional and psychological outcomes rarely make headlines. We count the bodies of the women, but do we count the broken minds? Why, you may ask? And I respond that it is because our culture is one of silence. A culture that encourages that we neglect the pains of others as long as it's not our business. A culture that encourages us to put our head like ostrich with head in sand. A culture that encourages us, especially as women, to be strong, to be happy, to be grateful, to suck it all in and pretend like it's okay. A culture that leaves no room for sadness, no language for emotional pain, and a culture that calls it laziness, weakness, or worse still, a spiritual attack or witchcraft. It's not just neglect or invalidation to the women, it is a public health failure. Worldwide, however, nations are responding to the public health crisis of maternal mental health. In the UK, maternal mental health screening is routine in all antenatal clinics. Australia invests heavily in perinatal mental health, and even Kenya and South Africa are integrating mental health into maternal health policies. In Nigeria, however, less than 10% of public health workers are trained to detect mental health issues. Some are, but not many. There is currently no national perinatal mental health strategy, and fewer than 200 psychiatrists serve a population of over 200 million people. It's not just a health systems issue. It's an issue of governance, equity, and a moral issue. And while it may appear easy to identify the impact that declining maternal health has on mothers, the hidden consequences show us that when we ignore maternal mental health, not only do women suffer from depression, anxiety, withdrawal, the babies suffer because they face developmental delays, poor attachment, and malnutrition. Families suffer as fathers become overwhelmed, marriages break down, and children grow up in emotionally unstable homes. The nation suffers because depression and anxiety reduce economic productivity. Women drop out of the workforce, children underperform in school, and the cycle of trauma continues. In Nigeria, the economic losses are staggering but invisible, and the human cost, irreplaceable. What then is the solution, you may ask? And the solution starts with me and you today. It starts with breaking the silence by listening, investing, and responding. We need to act on 3 major levels. 1, policy and leadership. Everything rises and falls with leadership. And so we must develop and fund a national maternal mental health framework and include mental health in maternal care guidelines, in insurance, and in our universal health coverage. Two, our healthcare systems must continue to train frontline workers to screen for maternal mental illnesses using simple tools like the PHQ-9 and the Edinburgh postnatal depression scale. We must set up referral pathways that connect women to care, even if it is tele-mental care. And then we must do things at the level of three, the community and culture. I would say that we must change the conversation to change the culture. We must remember that when a child is born, a mother is born. A woman changes and her life changes forever. And so we must educate families and churches and traditional birth attendants. We must launch anti-stigma campaigns in our local languages, Yoruba, Hausa, Igbo, Pidgin, because language shapes reality. We must use our local and traditional media, including social media, radio, social media influencers, to normalize mental health help seeking. And we need to help women to find the power with their voices, to reassure them that their challenges are not unique to them alone, that they are not abnormal for feeling what they feel, that they are not alone on their journeys, and that help is indeed available. We need to help them find their voice, to educate and empower the women to use their voices as a tool. When a woman can talk about her pain without fear, and she begins to heal. When our community listens, she survives. However, when our government responds, she thrives. As a psychiatrist, I have held the hands of mothers lost in despair, pain, and darkness, and who have lost a sense of self. And of course, as a Nigerian, I know that we can do better. It is time to break the silence, to lend our voices to this important discourse. And like this generation says, to Sorosuke, speak up, because there's power in our voices and in our numbers. When a woman breaks down or struggles, she's not weak or broken. She's waiting for a community and a country that sees her, that hears her, that heals her, that validates her. I charge each and every one of us here today, and those who might be listening online, that we shouldn't just let this conversation, this event, be another event. I encourage us to let it be a call to courage, a call to commitment, a call to break the silence. You all seated here today are the policymakers. You are the health workers. You are the storytellers, the influencers, the change makers. And so this is your moment to listen, to act, to lead. Let us not wait for another tragedy, another Grace and the babies to shake us. Let this room be where the change begins. Let it be a turning point. Let us be like atoms in a container, gaining energy and sharing that energy with someone else. Let us invest in maternal mental health, not as charity, but as public health, not as a women's issue, but as a national priority. When you care for the mind of a mother, you protect the soul of the nation. We are not just saving lives, we are saving futures. And so whether it's Grace, whether it's Gbonju, whether it's Memunat, Buki, Nkechi, Alima, Sheon, Memunat, thousands more, they are waiting. Let us invest, let us listen, let us lead with hope and direction. Let us break the silence together. Distinguished ladies and gentlemen, I'd like to thank you and welcome you all to the session. I wish you all a fruitful deliberation. Thank you.